comfortable that she wasn't
Yeah.
inconveniencing everybody else too much.
Yeah. Not at all.
So you two knew each other then for some time before this?
Yes.
So you were good friends before
We
this?
met
this
through
one?
our sons, actually, who've been
Yeah.
playing since they were young boys.
I see, okay.
They knew each other in school and played soccer together.
Okay, okay. So anyway, you get through the process, you've been screened, you have to then have some testing done, which it sounds, what is that? Is it a simple blood test, or is there more to it than that?
It
But
does
for
begin with
Maura.
the blood. The first thing is blood type compatibility is a very
Well,
first.
actually, the first thing for me as a donor is the test to make sure my kidneys are functioning properly.
Oh, okay.
And that is a 24-hour urine screen. You
I
collect
see.
all your urine for 24 hours, and you bring it in a giant jug to the clinic. And then that tests kidney output. Then once it's established that the kidney is working, then we did a blood test where both of us who were considering donating, because our other friends' function was fine. We didn't know at that point what the shape of her internally was. But then the three of us went to the clinic together, and we all gave blood that mixes to make sure that each of our bloods would be compatible with Donald's.
I
Does that
see.
That's right.
explain it? Yeah.
And there's 6 antigens in the blood that they match for. I think if you're identical twins, you match on all 6, but we matched on 2, which was enough to do a successful transplant, according to the statistics.
Okay, okay. So you did have some matching there going on. And so they probably look then right there. They don't just look at your blood, but they look at how the two work together,
Right.
evidently, yeah.
There's also chains of donation, which have been in the news recently. So Maura and I are the same blood type. If we weren't, and she had been recognized as a good candidate because her kidney was in great shape, but let's say she was O positive rather than A positive, then they might find somebody who had an A positive donor and just made the match. And at Leahy, they told us that they've had cases where they've had kidneys passing in different directions on Route 93, one coming up from a hospital in Boston and one going down to Leahy as they match up the right blood
okay.
types with the right people.
Okay, so the people aren't necessarily in the same room or in the next room.
Right.
They actually travel. Okay. Well, yeah. So yeah, we have read about that sort of thing where
Right.
you
It's
get
not
3 or
the
4
same
people
person. Where
involved.
if all of us need a kidney and I give you a kidney and you give Laura a kidney and Laura gives Donald a kidney, or well, if all of us are donors,
Right.
well, I give a kidney to someone who needs it anyway.
Yeah.
Yeah, it
The
all
process
works
goes so that everyone who needs one gets one from a donor who can give one. But I was able to be the direct donor for Donald.
Okay, okay. Now, was there any kind of counseling involved for either one of you beforehand about what your expectations should be versus reality, or their support groups? How did that all work out? Or you just went in with your own psyche
Do you want to
intact?
answer first? Or?
I can answer first.
Sure.
At Leahy, on the very first day where we went for the assessment, and my family came along with me. My son was off from school at the time. My daughter, who's working in Japan, was home for the holidays, so we went down, all 4 of us, and they'd like to see that because a supportive family group is one of the indicators of a successful operation outcome.
Sure.
And so they spent the entire day with us talking to the Leahy people, which included, among others, a social worker who addressed some of the emotional and family issues about receiving a kidney. And then with all of the nephrologists and surgeons and other people we met through the course of the day, we were pretty well prepared for the sorts of things that would happen. They even brought in a pharmacologist to say, and these would be the kinds of immunosuppressants and other drugs you're taking afterwards. So it was a massive amount of information that presented us with a lot of detail about what we could expect leading up to, through, and then after the operation. Then at Leahy, they also have a kidney transplant support group. I think they meet once every month or 2, and we went to several of those, including how to deal with kidney disease from a food standpoint, and what a kidney donor recognition night, which we just attended this year, just recently. So there's a lot of support for the recipient. So.
And so how about you, though, as the donor? Do they have similar support for you?
Yes. From a donor perspective, one of the first things that you have is a complete psychological evaluation, which is, you want to give a kidney? Are you crazy? And even before you sign the form that gives your consent, a social worker has to read it aloud with you and make sure that you understand every single aspect of it and what it means. So that was the first thing, and before I signed anything, I had to read it aloud with a social worker, so we did that. And then I think I had 2 other visits. The head of the psychology department at Leahy just sat down with me, asked a lot of questions. Their main concern was that I was not being pressured by anyone to do this, which I wasn't, and that I had adequate support at home, that my family gave their support, who was going to take care of me after surgery, would there be people at home, and how would I manage that. So that's mostly what they asked me. And then Denise, the donor coordinator, put me in touch with a woman with a very similar background to mine who had donated a kidney to a friend so that I could talk to someone who'd been through the same experience. So she put the 2 of us in touch, and we've phoned and emailed one another. We've actually not met in person. We keep missing each other. But that was really helpful for her because she had been through it all already, and say, well, here was my experience, and here's what happened to me. So that was the support that I had.
Yeah, so it's another way that she could support the whole process as well.
Yeah, it was nice to talk to someone who
had been there,
been through it. Yeah.
So then you get to the point you have the surgery. So was that what you expected? Can I ask? Is that too intrusive? I don't know.
Well, I think the surgery was intrusive. So.
Well, yes, it always is, isn't it?
I had actually gotten my head around the idea of surgery. I think a lot of people, at least from what I was reading ahead of time, start to panic or get anxious about the surgery. I was looking at this as my alternative is another 3 to 5 years on dialysis or a lifetime on dialysis. I was just reading about somebody who's been on dialysis for 31 years.
Wow.
And I didn't look forward to that prospect.
Right.
And so, this was, for me, the best possible outcome. And so my mind said, just be relaxed, be calm. I do have to say, though, the night before I was heading off to the last dialysis treatment, they want to get as much of the toxins out of your blood and fluid out of your body before you go under the knife. And I slammed the car door on my finger as I was rushing out of the office. And the next morning, that's all I could think about. My finger hurt so much. Oh. And that
it took your mind off.
It took my mind definitely off. So it would be my advice to anyone undergoing major surgeries.
Slam your finger first.
Yeah, right. Break a bone or something. No.
So while I was with the anesthesiologist ahead of time, I asked if they could do something about it. He said, oh yeah, we'll take care of that during surgery. And so they lanced the finger while I was under anesthesia.
Got a twofer there.
Yeah.
Okay.
Got my money's worth.
Yeah, I guess so. Yeah. And now, how about for you in terms of the surgery? Were you nervous going in at this point, or you just
not on the day of? No, I think prior to the surgery, because delays kept happening. I think it was March, April, when we began testing, and I knew I was likely to be the candidate, and we learned that our other friend couldn't do it, so that I was going to do it, and then glitchy little things would come up that nobody would test in this level of detail except when you're a donor. Someone puts their hand in the air and says, no, she can't donate until you do this other test. So I was having test after test for things that ultimately were nothing. My primary care physician, who was receiving all of my records, had me in at one point. She looked at my file and she said, do you know you have the thickest file in my practice, more so than anyone who's ill, and you're not ill. So it was just, it was through August before I had finally passed every test, because the donor team they're my advocates, and if they saw anything that made them, they saw a slight anemia, and so they thought it was possible that my stomach was bleeding. So it was, when you have a colonoscopy, we also want your stomach scanned as well, and we had to get permission for that. And so it was anything they could possibly think of that might be wrong, they tested it. And so I was really, really, really healthy going in.
Right.
But there was, between April and August of not being ready, and then Donald had some setbacks with his health. And so then I was worried, and I started lobbying the clinic. I'm like, this is getting a little silly with all these extra tests. Can we just give Donald the kidney now because he's scaring me.
Along, huh?
And they said, absolutely not.
Oh, okay.
So, you know, until we say you can go, don't even ask us because, you know, we haven't said so yet. So, okay, and then so between setbacks and the rest of it, it was January. But there were, you know, the middle of the night, things look worse.
Sure.
Sometimes I'd wake up in the middle of the night, I'd sit up in bed and say, no, I can't do this. I just cannot have surgery and give a kidney. And I knew that Donald and Karen would understand.
Yeah.
You know, if I sat up and said that, and I'd say, no, it's the middle of the night.
Right.
So you can make that. And I would give myself until noon the next day to make the decision if it bothered me. And usually I wake up and I say, well, this is silly, I can do it.
Yeah.
By the day of the surgery, I had completely wrapped my head around it. And, you know, I was just so glad to finally be there to do the thing, because I had, at that point, been thinking about it for probably 8 months.
Right.
It was too long to think about it.
Oh, okay. Almost like being pregnant, you know.
Yeah, exactly, yeah.
You have a long time to
Well,
think
wasn't
about
there a
it.
concern as well that the tests are good for a year?
Oh, yeah.
And
Oh,
so
that's
if we
another
had
thing.
stretched it out to, say, March,
Yes.
when Maura had begun the test the year before, she would have had to go through the whole regime again, the whole protocol.
Right.
Yeah,
Right.
and it's long. I mean, the
Yeah.
testing for the donor, there were, I mean, it's long, and it's a drop in the bucket in the terms of overall life, but it was, you know, tests that begin at 8 in the morning and you're dismissed at 5 in the evening, and there were 3 days of those kind of tests, and I had to schedule them in and around, you know, work I was doing and that sort of thing,
Sure.
and
Yeah.
so that was, you know, just a little frustrating.
Right.
It was fascinating to have all those tests.
Right. Well, then you got a clean bill of health when they were all done.
Yeah.
So that must have made you feel great in a way. Okay. So then I've heard that for the donor, the surgery is often harder. The recovery is harder. Would you say that's the case, or is that just an old wives' tale?
Well,
Or is it hard to compare because you don't know what the other went through?
yeah, everyone has told me that that was the case. I mean, always when people hear you're going to be a kidney donor, they say, Maura, do you know it's harder on the donor than on the recipient? And I have to say, I think there is probably nothing about kidney donation that I haven't already been told
Right.
3 times
Right.
by a surgeon, a nurse, a nephrologist, a pharmacologist, a dietitian, a cardiologist. I mean, all of the, you know, so it was just interesting how, you know, and that was the first thing that they heard. And yes, everyone had told me that largely because, you know, the kidney's way in the back.
Right.
And so, and it used to be, back in the olden days, when you were a kidney donor, 12-inch incision through the back, move a rib, pull the kidney out the back. Now it's small incisions for laparoscopic equipment, and that's how most of it's done, and then the kidney comes out through a 3-inch incision by the navel, or at least in my case, you know,
Right.
somewhere in the front. But because they cut through so much muscle and tissue to get back and get the kidney out, that's more of a cut than the cut for the recipient who has the kidney doesn't go where the other kidneys are, and you'll have to speak to where it goes, but it tucks in more quickly and easily.
I see.
So there's, from a standpoint of having a really deep knife cut, my knife cut's deeper than yours.
Okay. So that's where the recovery process comes from, probably a lot of it.
But he has to take immunosuppressants and get used to a new organ. I just have to get better from donating a kidney, which, you know, is like, it's major surgery, it's 6 weeks, and then you're better.
Okay.
So.
All right, I know we're running short on time here, and I just want to ask quickly about sort of your emotional bond. Has it changed? I mean, you were friends before, you knew each other well, you had family connections. Is it about the same as it was, or do you feel it's deeper or not?
You have a great answer to that, I think, in terms of our new familial
Oh,
relationship.
that's right. See, Donald and I have the same birthday, which is April 9th.
Oh, wow.
And now,
good.
if you test us in the kidney, we have the same genetic material. So I maintain that people with the same birthday and the same genetic material are identical twins.
Yes, it
Yeah,
does
so
sound
this is
like
my
so.
identical twin brother.
So you now have that bond of being identical
Yes.
twins.
That's right.
Okay.
I think we always will.
Okay.
Yeah.
Do you have any last thoughts as we, you know, come to the end here of our program? You know, just really quick
Yeah,
thoughts.
one of my wife's friends had a really interesting statement about Maura's donation. She said, God gave us 2 kidneys, one to use and the other to donate. And I think that's a good sentiment to anyone who's not already a kidney donor.
Okay, and that's a great sentiment to end on here. So I want to thank you all for being here, and I want you to check out the New England Organ Bank's website, and I want you to also, if you want more information, look at the Leahy Clinic's website. They give a lot of information there as well. And I thank you for sharing your stories, and I encourage anyone out there to become an organ donor and move forward with this. So thank you so much for joining us tonight.
Thank
Thanks
you.
for being
Thank
here.
you.
Okay, thank you. You're welcome. for a minute or so.